Hi, it's Dr. Dave McCreary from POCUS UK, and in this short video I'm going to be showing you why I think you should use POCUS if you're suspecting a skull fracture. So I was asked to review a very well 11-month-old boy who came in with his parents after they'd noticed a lump on his head. My junior colleague had examined him and found a shallow but diffuse lump approximately 6 centimetres in diameter. The infant did in fact look well and had no relevant past medical, family history, or most importantly, no obvious reasons to why this lump had appeared. So I examined and I realised I wasn't really able to infer a great deal else with examination alone. So I did what I would always do in this scenario, which is to extend my clinical assessment using POCUS. I did so with a high frequency probe. I placed a large amount of gel over the area of swelling. Often infants will tolerate this really well, and children of all ages. In this case, the infant was held in the carer's arms. And this is what I found when I scanned. So we're looking at the hyperechoic line beneath the skin and layers of connective tissue, and that represents the bony cortex. Now, it doesn't take a POCUS expert to identify that this bone was not intact and that above it was a small area of hematoma, which appears dark or hypoechoic generally, but with some complexity within it, which is quite a characteristic appearance of a hematoma. So naturally, we expect to see the hyperechoic bony line as a smooth, unbroken line in all planes, whether we're scanning longitudinally or rotating the probe into a transverse or an oblique pattern. These appearances clearly here with the splintering and the fragmentation represents a fracture. So because I was confident in my findings, I said to the parents, he has a skull fracture, and I hadn't been presented with any obvious mechanism as to how this non-mobile, only cruising around infant who wasn't yet independently mobile had sustained an injury like this, and naturally this presented a significant safeguarding concern. Now, why this case really sticks out in my mind is because utilising my findings from POCUS, I was readily able to speak to the relevant safeguarding professionals, which was my colleagues up on the ward for paediatrics who are going to be undertaking any further child protection assessments, also speaking to the social work team, and most importantly obtaining further imaging, which I knew would be necessary in this case. And shown here is the child's CT scan. We can clearly see there's evidence of a fracture, and this confirmed our findings. So for those who haven't been utilising POCUS for fractures, we know that it performs really quite well. In addition to clinical assessment, these are some examples of occult fractures that I've identified, either where the wrong part of the body's been x-rayed or where the clinician involved initially wasn't too sure as to what was going on. So we can clearly see it highlights the break in the bony cortex for a range of different fractures and a range of different body parts very, very well. Now, in particular for skull fractures, a recent large systematic review involving 925 patients as a pooled number was published in the EMJ, which showed the performance criteria for POCUS, which were really, really reassuring. And that's quite an in-depth article if anyone would like to read that. So for PEM clinicians and paediatricians alike, we know that head injuries are ubiquitous. Normally the children appear just like this, entirely well, but very happy. The benefit that POCUS can confer for assessment of children is when we have very large hematomas. There may be concerns about a step-off suggestive of a fracture, and clinically that's some of the signs that people have relied on historically. But naturally this isn't very scientific, and many large hematomas and many hematomas where there's some bogginess or there's some step obviously don't have a skull fracture, and we know this because probably they've ended up eventually having CT scan, which I don't think is a really justifiable amount of radiation in the bulk of cases. We're obviously talking about well children here, not those who require further assessment or who have neurological concerns or other red flag features. But purely for assessment of lumps on the head, either traumatic or otherwise, we can visualize really nicely all of the structures beneath the skin and assess the bone in a lot of detail. So I would recommend that POCUS is used in cases to measure the size of a hematoma and to assess the underlying skull if it's just a large hematoma and no other signs exist, and also just to take a more in-depth look at whatever lumps could be occurring. The smaller the child gets, as shown in this next image, and the larger the hematoma becomes, the more concerned those around you are likely to be as to whether or not a CT scan should be performed purely to look for skull fracture. And I think you probably know that in the bulk of cases, most children who are fine, that isn't something you'd want to do if it's not justified. So what I would recommend is POCUS is an extension of your clinical assessment. It's a useful tool, and it should be something that you can begin to integrate into your clinical assessment. Now, there are some pitfalls associated with this, and I'd like to go over one or two. Obviously, those who are undertaking skull POCUS should have had their own specific training, that you're happy understanding the relevant anatomy. And I think one thing that's relevant to point out early on is that when scanning infants' heads is that of the suture lines. So we know that the infantile sutures are present and not fused, certainly within the first year of life. And I think if you're concerned about an area of injury or a lump or a bump within this region close to a suture line, it's really important to be aware of the normal anatomy and to follow the symmetrical suture line from either side of the skull, comparing the area you're scanning with that of the contralateral side so that you can be certain what you're not looking at as a suture. Suture lines do look slightly different on ultrasound. They don't have the classical appearance of fractures that I've seen in terms of the sort of fragmentation and the irregularity. They tend to look a little bit more regular, but certainly they can catch users out. Another really interesting condition which I've came across when scanning a head is that of Langerhans cell histiocytosis. This child in question for me presented with a large lump with trivial trauma in the preceding few days. So we were obviously concerned about traumatic fracture, and the appearances we saw on this scan looked fairly similar. There was a significant soft tissue, what appeared to be soft tissue swelling, and then a break in the bony anatomy, and there was just something about it that didn't feel as though this was a traumatic injury after all. It was too extensive. The soft tissue region didn't really look suggestive of a hematoma, and in fact the breakdown in normal bony anatomy didn't look exactly as I'd expected for a fracture. So this was a child who eventually had a diagnosis of LCH, which is obviously a rare diagnosis. We know these children are going to require further workup, including imaging and eventually biopsy to confirm the diagnosis. So I think as long as that's in the consciousness of those who are scanning as a possible pitfall and an appearance that can look similar, I think you shouldn't be put off undertaking a POCUS. Remember, it is a tool to be utilised, not to compare against other imaging tests, in this case CT or MRI, either for trauma, for intracranial injury, or to fully investigate another rare condition such as LCH. It's predominantly to allow the clinician to get to the point where they can understand which test, if any, is the best one that would need to be used, or to involve the relevant specialties. So in summary, POCUS is a really useful tool for lumps and bumps on the head. In the context of trauma, this can be really useful for excluding skull fracture, and I'd recommend people to give it a go.